So we just had a lively debate about whether CMV T-cells can replace drug therapy, and my personal answer is yes, but because I was arguing that they could. But in reality, I think everything has to be given as a combination strategy. So in actual fact, I think we do need drug therapy for CMV. There's some really exciting results coming out with the latest drugs, most recently letermovir. But as was pointed out by my Dr. Lungman, who I was debating with, this isn't available in children, and what he failed to mention is that there is a lot of cost associated with the use of these newer agents. So where CMV T-cells can really make their mark is in several settings. Firstly, I argued that perhaps everybody should get a virus-specific T-cell product after bone marrow transplant to prevent not only CMV but the multitude of other viruses that affect our patients where there is no other drug therapy for them. The preventing viral infections in general would hopefully prevent graft versus host disease, and so this would have a better effect not only in the outcome for the patient but the overall cost in terms of morbidity and financial costs to the patients. So it was interesting. I did this debate 2 years ago with Dr. Lungman, and we asked who had virus-specific T-cells available to them in their facilities in their transplant programs, and pretty much no one put up their hand last year, but about a third of the room put up their hand this year, which really shows that virus-specific T-cells are becoming more broadly available. There are several multi-center, multinational studies now coming out of cooperative groups, consortiums, as well as more recently industry. So I would say that in 2 years it may be very categorically yes for virus-specific T-cells, that they will be the winners over drug therapies.